Hey 302, I'm Jackie Ferris. On this week's show, we're going to be talking to Delaware's Lieutenant Governor, Bethany Long, about COVID in Delaware and efforts to mitigate the spread. We'll talk about vaccination, schools, and businesses, you name it, top to bottom, we're going to talk about it. Stay tuned, the 302 is headed your way. COVID-19 has been front and center in all of our lives for the past year, but now that people are starting to get the vaccine, how are we doing? We're joined now by Delaware's Lieutenant Governor, Bethany Long, to talk a little bit about efforts to mitigate the spread of COVID and what's being done about the state's vaccination program. Lieutenant Governor, thank you so much for joining us.
Thank you. And it's always a privilege to be with you on 302 and to share the activities that we're doing across the state, working both with local government and many nonprofits and leaders to really address this pandemic. So all hands on deck.
I wanted to ask you, the University of Delaware recently reported the biggest spike that it's had since the pandemic started, 324 cases. Is this evidence that we're still in the midst of a fight with this virus? Or is the state starting to turn the page with the vaccination program?
Well, what we have is kind of a mixed bag. What I would say first and foremost to anyone listening in 302, until we have a substantial decline in hospitalizations, no one in critical condition, both here in Delaware and across our country and around our globe, this is a pandemic. We have to follow all the measures of masking, social distancing, even while vaccinated. And most importantly, get vaccinated when it's your time. And love to have the conversation a little further about that. Certainly, as a professor at the University of Delaware, whether our campus or other campuses across the country, we do often see younger adults as sometimes carriers and don't always practice the best behaviors when they're not necessarily on campus. And that's not to single out an age group or category, but our behavior matters. And so until we are vaccinated fully, not only in our state and our nation and around the globe, we have to follow all those measures, every single step.
Now, recently, several states have lifted their masking requirements. Is that something that you find concerning at this time?
Speaking not only as an elected official, but as a professor of public health nursing and professor in epidemiology, we know how diseases spread. And we recognize that COVID-19 is spread through your respiratory system and droplets through your mouth and your nose. Therefore, it is concerning, I believe very strongly, both in the mandate that has been set through our White House and through our governor. It is a really good measure to keep us protected. And let's face it, one factor that doesn't get discussed as much this year because we had masks and we were washing our hands, our cases of flu were lower this year. It matters to really listen and to follow. So I will tell my personal friends and family to continue wearing a mask. Those who even live in those states where they have been lifted, they are continuing to wear masks.
Now, I know that Delaware is hovering around the 200,000 mark in terms of people that have been vaccinated. You are at the front lines vaccinating people yourself. Can you tell us a little bit about what's happening and what you're seeing?
Yes, it's been a privilege. One of the things I enjoy the most as a public health nurse and the head of the Delaware Medical Reserve Corps, I'm the PI through the University of Delaware in partnership with the Division of Public Health, is really coming together, making sure as we follow CDC guidelines on who's eligible to be vaccinated, that we do it in a structured, planned, equitable manner. Now, there's been, challenges. This pandemic, last time we talked as the co-chair of the Pandemic Resurgence Advisory Committee, there's no playbook. And there wasn't a perfect playbook on how we roll out all the vaccines. We've learned, but we followed the guidelines. Right now, we've taken care of our frontline workers, our health providers, our first responders, And now we're working on our higher risk categories who suffer the most death, which are our elderly. So again, we're working through that. And as you stated, out there vaccinating in those capacities with not only myself, the Medical Reserve Corps, but my students were out. And I see it going very smoothly. Individuals are coming prepared. They recognize that they're getting Pfizer and Moderna. They need the 2 shots. They come back for their vaccine. And we have lots of systems helping. Hospitals, fairly qualified systems, our primary care providers, and then certainly our Department of Education has a mapped out plan. So, it really is all hands on deck. And I can tell you, the vaccines are simple, they're easy, it's painless, a little soreness in the arm. I encourage you to come out. For many of us, it's just a quick process. We know initially there were some glitches with timing, but we've gotten it down to a really good schedule now. And we're coming out to your organizations, to your faith leaders, to your communities, your churches, your synagogues. We are coming to you, and we want everyone to be vaccinated.
So we're at a point now where we have the vaccine, but it's limited. Now we've got J&J on the scene. We've got 3 vaccines. The vaccine makers saying at the end of March that they anticipate that they're going to roll out 240 million doses. How are we going to be able to handle, that's 50% of the US population. How are we going to be able to handle that kind of volume?
Well, it's an interesting question. I chair the National Lieutenant Governors Association, and we were having that conversation some last evening, talking about our approaches. And all of us are fortunate to have multi-tiered systems to help us vaccinate, whether it's our family physician, whether it's a qualified health center, whether we're working in tandem with teams that are specialized with our National Guard. We in Delaware, last week had a fantastic experience with our federal emergency management partners. And so as you will see nationally, large hubs to small venues to mobile units, we will be in every format possible. So picture like an octopus with all 8 legs going, big pods, small vaccine events, outreach, you as an individual signing up. And certainly Johnson & Johnson is 1 shot versus the 2 with Pfizer and Moderna. We'll also make it a little easier for us to vaccinate and help each other. It's just as important, to be vaccinated, not so much for yourself, but for your loved ones. And it's very safe and very efficient. And we just really appreciate 302 highlighting the importance of the vaccine. I know it's really critical.
It certainly is. We're going to take a quick break and we're going to come back because there's so much more to talk about the status of COVID in Delaware. We'll be right back.
I am Dan with Fearless Improv, and you are laughing with the 302.
Welcome back. We're talking with Lieutenant Governor Bethany Hall Long about COVID in Delaware and the vaccination program. Now, Lieutenant Governor, you're on the front lines. You have people coming in we have our seniors, 65 and older, our healthcare workers. How do we let people know who's eligible? And in Pennsylvania recently, the governor added teachers to the list to the first 2 sections. How do we find out, is this an evolving list of who's eligible and when they'll be eligible in Delaware?
Absolutely. I know since last March when we have experienced COVID in our state, we created a very simple website, de.gov/coronavirus. We also have easy access now, working in partnership with United Way and many other nonprofits by dialing 211. Anyone can be able to access the information as to which category and if they are eligible. I think that there has been a lot of press. There's also been a lot of misinformation. There's a lot of confusion, and we want to eliminate that. And so that's why we've really tried to reach out to all communities in multiple languages, working really hard through faith leaders, through our Latino leaders and others. I host meetings, for example, in my office, weekly calls where we want to ensure that everyone gets all the information so that people can make, a personalized, informed decision.
So, equity in vaccine distribution, it's available for anyone that's over 65. But some people in minority populations, there's there's a disconnect there. Can you talk a little bit about why that disconnect exists in some of our minority communities? Is it a language barrier, you think? And what are we doing to combat that?
Well, it's very important, whenever you have a pandemic, that we make sure everyone has equitable opportunity, whether to a vaccine, whether to treatment, whether to screening. And so we worked really hard with COVID testing, and we're doing the same now with access to vaccines. We have lots of incredibly smart persons across our state, both leaders in our Latino and our Black leaders communities, as well as our hospital systems and not only the public entities. Government cannot do this alone. We have to do this from the community. And we have put in place particular pieces of information, literature, social media, outreach to give people informed decisions. So turning to those leaders that people trust, really important. I know as a public health nurse who has spent over 3 decades predominantly working in high-risk communities of color, it's very important that people have that relationship and trust. And COVID has just shed a light on the inequities we recognize care, a primary care provider, or if it's housing, education. And so this is a really important window of opportunity. And I am encouraged. I am really encouraged by our leaders across the state. And again, in both Caucasian and non-Caucasian communities, stepping up and sharing information and breaking down myths and fears, really important.
Are there steps being taken to help those people with the mental health issues that all of us may end up with, like a COVID PTSD, is if it were?
Yeah, absolutely. We have a continuing epidemic of opioid crisis that has continued throughout our pandemic with the physical health, and our emotional well-being is critical. And that's why we have established the DE Hope Line. We have bridge clinics that are available. We have 24/7 mobile crisis. And so we would encourage persons to turn to our Hope Line. And again, you don't have to have immediate insurance or access, but if you need someone to speak to. Delaware's worked really hard. I'm very proud of our behavioral health consortium that we are one of the few states, believe it or not, in the nation that had one of the smallest percent increase in overdose deaths this year. But it's taken an incredible amount of work, and particularly during a pandemic. We still have far too many persons that we place in the ground, that we bury our children, our parents, our loved ones. This year, with approximately 450 or so, it's not a final figure, but we have to make sure people continue to have access to behavioral health. And again, you've been home with kids, online school, you've been taking care of parents, so stress is a little high. And so it is okay not to be okay. So we do have mental health services. Our team has teamed up with the Kennedy Forum, Patrick Kennedy, who basically talks about mask COVID, not your emotions. Really important. Mask COVID, but not your emotions. So speak up, talk to somebody.
I know that that can be important in order to get through times like this, but we want to talk about kids, we want to talk about schools and businesses, and we're going to do that when we come back.
I'm Stephanie Lampkin, and we're making history on the 302.
Welcome back. We're talking about the status of COVID in Delaware. We're joined by Lieutenant Governor Bethany Hall-Long. Lieutenant Governor, talk to me a little bit about schools. Right now we're doing hybrid learning, but there's been a couple of studies that say kids really are not thriving in virtual settings. Can you talk to us about when we could see everybody back to school?
I know one thing, it is really apparent to all of us that our children do learn best when they're together in a classroom with the faculty. However, we have to be safe. And I do know that working in our state, our Department of Education has worked diligently with also the teachers associations and unions and PTAs and parent organizations in particular with the governor's office, to lay out those opportunities, kind of a roadmap, a flight plan, right? Looking at the best methods. And so the hybrid method has worked for certain districts. Some districts have, decided to be all online initially. Again, a lot of it is dictated by what's happening in their local zip codes and their local community. And so that's why it's important. And you're spot on. We need to have our children together learning, because there is something about isolation and the online learning. And we have seen an increase, unfortunately, in our teen suicide rate this year and depression. And so it's really important that we get back, but we do that safely and we do that strategically in a smart way. And it takes everyone from our school bus drivers to our facility managers to our cafeteria staff, our school nurses. Everyone's worked really hard, and I am encouraged. I am optimistic that hopefully as we go past the spring and particularly toward the fall, we have everyone participating and vaccinating, we will see more schools open.
Whenever that time comes, there's going to be a little bit of catch up, I would imagine.
Mhm.
Are you aware of any efforts or any plans to put in place? I know that some states had canceled some standardized testing or moved it back, but is there a plan to kind of help our kids catch up and not fall behind because of the pandemic?
Right, and I think it varies. This again is an equity issue. Who has support at home? And I know some parents are learning algebra again for the second time in their lives. But it really, you need the resources. And I, cannot speak for each of the 19 public school districts and the incredibly hardworking charter schools and our many private school leaders in the state. But I can tell you, I know each and every one of them has put out a plan for kind of remediation, to make sure that our students do come full force. And part of this, I do want to take a little unique perspective that people have forgotten during these struggling times. It's not also, and I say this as a professor now, someone who teaches in higher ed and has done so for 3 decades. It sometimes is not so much reflective in the outcome on a score as much as it is of what we are doing to continue teaching the children about life and learning. And so I am optimistic that once we do get indications of who's fallen behind, who needs a little more support, we will be able to provide those services to the children. But we will come out of this, I am convinced, in years out with really solid plans and addressing even stronger behavioral health challenges that kind of before were sometimes not at the top of the surface. This has raised it more to the top.
I wanted to shift gears to businesses. I know that some small businesses have closed, others have, let go employees and really had to change things up. When do you anticipate? I know you said you didn't have a crystal ball for schools, but where are we in terms of capacity for restaurants? And when do you think that we might be able to kind of give them a little more room to allow the public in?
Well, there's nothing more important in life than socialization and food and restaurants and business and being out in the community. And I know as co-chair with our Secretary of State Bullock of the Pandemic Resurgence Advisory Committee, that there is a very clear roadmap in place, very much working with Division of Public Health direction, along with our governor's office as to when they will ease certain restrictions, allow larger gatherings. And again, it's dependent upon our community. So I wish I had a date that would have been shared, but our governor's office and DPH are following the data. So mask up, wash your hands, socially distance, and please, get the vaccine. Sooner we do all that, the sooner we'll have more capacity and be back to more of a normal experience, whether in restaurants or in businesses or in sporting events. So get vaccinated. Do what you have to do when it's your time.
When I was looking at the state website, I noticed there was a little notice there about COVID scams. Are there COVID scams hitting?
Unfortunately, there are. And one of the great things that our governor's leadership early on was in his executive order, was to actually, put in place, penalties and fines. We don't have room for that, but we have everything from the most egregious. The most egregious to me as a nurse or, fake offline, N95 masks. I mean, it's just egregious, but people do it. They manufacture, they try to sell. and then you have people scamming people, on phones and monitors and about grants and money, so again, if you're in doubt, call 211, contact our public health line, contact Better Business, give us a call. We will make sure, because again, we cannot afford, on top of the stress we already have from COVID and the financial stress that our businesses have right now, we need everyone dealing with legitimate services and legitimate organizations.
Before we go, I wanted to ask you about an event that's coming up on the 24th, Women in STEM Day. What's that all about?
Well, I'm really, excited about the Women in STEM Day, our forum. We have this every year as the chair of the honorary chair of Million Women Mentors, both nationally, myself with Governor Reynolds of Iowa, and here in Delaware, we have incredible young, bright entrepreneurs such as Jackie Means, who's a young role model in our community and state, to heads of corporations, and vice presidents and leaders like Terry Quinn Gray and others. But as the STEM Council has worked really hard in our academic settings, in our schools, and our communities, this is just a great day to celebrate. We need more women, whether in science, technology, engineering, or math, and to inspire our next generation to not only be at the table, but to be creating that table. And so this is just a great celebration. And I'm so glad that you mentioned that to me. That's awesome.
And submissions are now open for the Lieutenant Governor's Challenge. Tell us about that.
Yes, they start next week, March the 8th, and that is an incredible opportunity, whether an employer, a workplace, a school, an individual, you would like to not only get physically as well as you possibly can, but perhaps emotionally. We have applicants, they put in for an award, and it's a great way to kind of bring your office together or bring your community, your church, your neighborhood, yourself, schools, and you can have programs like mindfulness, yoga, stress management, weight loss. We've had state employees who've gone completely off all of their medications for blood pressure or cardiac disease or blood sugar problems, eliminated just by participating, learning about a healthy lifestyle. So I encourage you to step up, step in, sign up, join the Lieutenant Governor's Challenge, which will open March 8th.
All righty. Well, thank you so much, Lieutenant Governor Bethany Hall-Long. We appreciate you stopping by and talking with us. For more information on COVID in Delaware, you can visit coronavirus.delaware.gov. That'll do it for this week's episode. Until next time, I'm Jackie Ferris. We'll see you on the 302.